This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, a new version of the B-Hex pupil expansion device has arrived. It's called the 2.0 version and this is my first-hand experience with this newer version of the B-Hex. He's a 75-year-old gentleman who has a rigid pupil because of pseudoexfoliation. Pupil is around 4.5 millimeter. He has got an intermittent white cataract. And I'm going to use this device in this patient. The side ports are made. The capsule is stained with trypan blue under air bubble. OVD is placed inside the antechamber. 2.8 mm posterior limbal based main incision is created. Time to put in the device. This is the housing which has the B-Hex 2.0 device. The labeling is done and it comes in a green handle. I believe the original B-Hex comes in a blue handle. The technique of implantation is absolutely same. There's no change. So you just use the B-Hex forceps and then introduce this device in the antechamber and place it on the surface of the iris. And this is the configuration which I would always like to keep it. How is it different from the original B-Hex is that it is slightly bigger than the original B-Hex, and that's the reason it's going to provide a little bit of a better pupillary expansion, and along with it being bigger, it also is supposed to be a little bit thicker as well. I prefer to use my side port to engage the notches to the pupillary margin using the forceps, and this is a standardized technique which I prefer to use. The first two pairs of notches are engaged onto the pupillary margin, the hands are switched, the last pair of pupillary notch is placed inside. This is a rigid pupil and I have not pre-stretched it in any way. So it appears that the pupillary expansion might not be exponentially bigger, but the reason is that this is a rigid pupil and I have not stretched it. Because I don't feel the necessity in this case. The case seems to be relatively simple. I'm not expecting any zonular complexities in this eye. So time to perform the rhexis. Now this surgery is being done under a peribulbar block and the massage. The massage helps us to make the eyeball soft. So the risk of the rhexis running away is minimized. The capsule is punctured, the flap is raised, and then a 5 mm rhexis is fashioned in a single shot. So I've been telling before that of late I have stopped doing the two-stage rhexis in these intermittent lenses unless and until it is very much warranted. Time to deal with the nucleus. Superficial epinucleus is aspirated out. Time to chop the nucleus into smaller fragments. The tip is buried into the substance of the nucleus. The chopper goes in front and then the vertical chop maneuver is performed along with the lateral separation. This maneuver is continued until the nucleus is divided into 6 smaller fragments. Nucleus management is the easiest part in this case. Once we have taken care of the pupil and the rhexis is done, which happens to be the most challenging aspect in this particular case, nucleus management is extremely easy simply because it's very soft. Time to remove the residual cortex. That's done. The bag is refilled with OVD and the planned hydrophobic single-piece lens is placed inside the bag. Under the cover of OVD, the pupil expansion device has to be removed. Again, using the B-Hex forceps through the side port, I just go and disengage all the notches in a single go, and then holding one of these side bars of the B-Hex device, it's pulled out. So it's extremely easy to insert and extremely easy to explant as well. So I would recommend this device for any beginner surgeon who wants to try a pupil expansion device. I think this would be the easiest device to manipulate and manage inside the eye. OVD both in front and behind the lens is aspirated out. The side ports are hydrated. And that's it, the case is done. Before I close, I just want to demonstrate the atraumatic nature of this device. You can see the pupillary margin holds good and it looks as if no device was used, it is not stretched, there are no microsphincterotomies, so the pupillary margin looks almost pristine. So that is one advantage with the B-Hex device, as it is quite gentle. So that was it. Thank you for watching and hope you found this helpful.